All right, kiddo, what's up? What do you got going on?
My upper back's tight, and then my hips have been wanting to slip out of the socket. My right one more than my left. My head still a little tight right here, but it's not giving me bad migraines. It's just
Let's go check your bones.
tender.
All right, eyes closed. Kiddo, what happened? Go back and try again.
For those of you who paid attention to my videos in the past, I've ripped out the wall in my office. So I have more space. I'm still playing around with the layout of the cameras and what that should look like.
You did good. Look at me. All right, you push up. Go. Good. Try again. Push up.
Here I'm doing my basic exam that Dr. Michael Allen taught me and looking for patterns of normal versus abnormal, and then trying to associate that with areas of dysfunction in the cervical spine.
Push up. What are you guys doing today?
He has a C class that we're working on, so it's getting completely remodeled.
A C class.
It's like a RV almost, a very old one, and it's getting ripped apart because it's in horrible shape.
Half of it looks like it's on you.
Yeah, I was in charge of styrofoam.
I'm still toying with this camera angle. It's a little too dark.
Try again. Go. That's not where it feels tight. It feels tight up top, correct? Mm-hmm. Push up. Right here?
Mm-hmm. It's very tender.
Well, I want to see if one of these areas, if I push it, if it changes your facet tenderness. Does that change the tenderness right there?
Mm-hmm.
Is it less tender?
Less tender.
Okay. I'm going to lift on one side, block the other. How's that?
So as I pointed out earlier, Michaela has styrofoam all over her body, which is falling on my table and my floor. No worries, Michaela, it's all good.
I don't like that. Now, did you guys actually get any styrofoam out of the vehicle?
Yeah, I had to clear out all the walls. There's one back wall done and about 3 more panels in the ceiling, and then the whole roof's coming off. And then the floor is coming out and everything's getting stripped. We're only keeping the frame right now. And this was supposed to be his little home he was going to move into beginning of this month, and he's like, oh, I'm just going to, take this out. And he's like, oh, that's rotted. And then it just turned into a hole. Oh, this is bad and that's bad. So he's got a lot to do. Ooh. That was weird.
Try again, go. Okay. Push up. Okay, we're not done, but go walk. See how your body feels.
Should have brought a vacuum, I'm sorry.
One of the things I'll do is I'll have patients walk around between treatments. I want to see what that specifically does to their system, how it's incorporated into their tissues, their body, and how it causes them to subjectively feel.
My hips feel better.
Better? On your back. My cleaner's coming after you.
Okay. We completely forgot. And then it was like an hour and a half before. I'm like, oh, we have an appointment today.
So far you're testing much better with that adjustment. Push out. Okay, that's not good.
Here I'm going to mobilize an area of her low back and see if it causes the reflex to become normal. Currently it's abnormal.
Hips are feeling, what else? Anything else?
The upper back.
Again, push out. All right, I want you to lay on this hip, face me.
Now I'm going to adjust the area that normalized the reflex. Every doctor does it differently. Some use motion palpation, some use a neuroscope. I use basic muscle testing with mobilization to determine the area to treat.
You can run.
Okay.
On your back, let me fix that. Push up. Okay, lay on your left. Face me.
Here I'm going to adjust her left sacrum. I adjusted her L4 and 5 on the opposite side.
On your back. Push out, go. Okay, that's more normal. Again, that's normal, push out. That's normal. All right, go walk and try that. And see how your neck feels.
From the hip adjustment,
Yeah.
it got tight right here.
Okay.
I don't know if that makes sense. I'm sorry.
That's your experience, that's totally fine. How's your neck feel?
It feels looser.
Is it tight right now?
So I feel something right here, but it's not tight. It's just like a tender.
But the low back adjustment affected it. Mm-hmm. Move your neck around again. Does that change anything?
Mm-hmm.
Better?
Better.
Try that point. Go.
Better.
How about this side?
Better.
Okay. Hands behind your neck, like that.
Behind my neck.
Yep, yep. Elbows together, squeeze. Look up. Now go walk around, see how that feels. Better?
Better.
On your tummy. How's the neck?
It's not tight right here anymore, which is really nice.
How's that?
Feels better.